Hi, everyone. I'm MILLI Long with Power of the Patient Project. Eating for two is something we've heard pregnant women say for years. With hormonal changes, cravings, and weight concerns, many expecting mothers can become overwhelmed during this time. So today we're pleased to have Dr. Nicole Avena with us, an expert in diet during pregnancy, a research neuroscientist, and pioneer in the field of food addiction. Her seminal research work jump-started an entirely new field of exploration in medicine and nutrition. Welcome, Dr. Avena. How are you?
Oh, thank you. I'm happy to be here.
Thank you for joining us. So let's just start with there's so much information, conflicting information sometimes out there about what to eat and what not to eat. Can you start by just giving us some general guidelines to follow?
Yeah, so I think it is a challenge. And one of the things that people face when they find out that they're pregnant or they're thinking about maybe getting pregnant is that it's so confusing to figure out what you should eat and what you shouldn't eat. And so just a sort of very general level of the viewpoint is you really want to try to avoid processed foods, avoid foods that have lots of added sugars, because these are not only bad for our body weight and also we know that they're bad for our brains. We know that they're bad for the way our gut microbiome is responding, but they're also often not really good in the sense that they have a lot of nutrients. And so it's important to try to minimize the processed foods and opt for foods that are going to be more nutrient dense. So our vegetables, our fruits, the lean proteins, really just try to focus on, a wholesome, healthy diet and minimizing the processed stuff. That's sort of my overall advice. But when it comes down to the nitty gritty, I think it also really boils down to individual preferences. I mean, people want to eat the stuff that they like to eat. So it's a challenge for the individual to figure out how can you kind of create this healthy diet that's going to help not only promote your own health, but also the health of the baby, which is, I think, the piece of it that people really get turned on to, because if they find that they're having a baby, that really can be an eye opener and people will say, wow, I want to be as healthy as I possibly can. And that really does start with good nutrition.
Absolutely. And I've heard the saying that kind of shop the perimeter of the grocery store because that's where the fresher things are, and try if you can to stay out of those middle aisles where the boxes and the processed things are.
Absolutely. That's good advice. And I think, if you can find yourself going to the grocery store more often, that's actually a good thing, because if you're buying perishable things that aren't going to last, then you're going to have to go buy more to replenish them. And so I think that there can be ways in which people can still eat healthy and avoid a lot of those processed foods. And that might mean that you just need to kind of rethink the way that you shop. So if you really like fresh produce, then yeah, you might have to hit the grocery store a little bit more often. But there's also options for frozen vegetables that you can buy in bulk, so you don't have to make too many trips to the store, or even canned vegetables are a really great option and can be a nice, easy thing to add as a side when you're cooking a meal.
We definitely need convenience. So our bodies usually protect us from things that are harmful. So why is it that ingredients that are so bad for us, like salt, sugar, fat, they taste so good?
I know. This is really the $1,000,000 question. And, it's one of those things where what we're finding from the research is that when you eat sugar, when you eat salty foods, when you eat these foods that have a lot of added fats and oils, they actually can affect the brain in a way that makes you want to eat more of them. And we've done a lot of research in my lab looking at sugars in particular. And what we found is that they can actually cause changes in the brain that are like what you would see with an addiction. And so this is why people find that they're often really compelled to eat, 3 or 4 cookies or 5 or 6 cookies. They can't just stop at one. And it's because the brain is being rewired in many ways, so that when you do see a cookie or you smell a certain smell of something that's delicious, it's going to trigger that neurochemical response. And it can be very difficult to not give in to that craving that emerges. And so I think this is important for people to recognize, because we get food cravings. They're a natural and normal part of the appetitive process, but sometimes we're getting these hedonic cravings where you're just getting the craving for the pleasure that you're going to get from the food, not necessarily the nutrients or the nourishment that you're going to get from the food.
Wow. So would you put a sugar addiction up there with drugs or alcohol or prescription medication because it's similar in the brain, or?
Well, it's a great question. And it's, a question that we've been talking about for quite a while now, because we have a lot of evidence that biologically suggests that sugar can be addictive, just like other substances like smoking cigarettes or even gambling or, drugs and alcohol. But does that mean that we put it on the same level? That's another question, because we have to think about this from a societal standpoint. I mean, usually there are regulations that are associated with the use of substances that are known to be addictive. Like, for instance, let's take alcohol. You're not allowed to drive a car if you've had a certain amount of alcohol. You're not allowed to buy alcohol if you're under a certain age. There's limitations on it, which are important and good for society. But we don't see those limitations with things like food. I mean, you can eat as much sugar as you want. No one's going to tell you can't buy, 50 pounds of it if you want at the grocery store. And so a lot of it comes from, societal views of addictions. And so, just like smoking, when you go back to like the 1950s, people were smoking cigarettes all over the place.
It was a cool thing to do.
It was a cool thing to do. It was very socially accepted and it was almost encouraged. But nowadays we know from research that is not a good idea. That is not the case. And there's lots of regulations in place that, forbid people from smoking in many situations. So I think that it's important that we kind of keep that in mind, that, over time, the view of addictions has changed in our society. And right now, food is the new kid on the block, and we're not sure how that's going to play out. But I think we'll see more and more happening over the next 10 years or so.
Sounds good. So how do you help patients break that cycle of addiction?
Well, it's an interesting thing. And it's something that, we've learned a lot about over the years of doing research on this topic, much like we've learned about addiction to other things like drugs and alcohol, that there isn't always a one size fits all approach. And so in my book, Why Diets Fail, I talk a lot about how the research behind addictions can help us to inform treating sugar addiction. And, one of the things that I talk a lot about in the book is that cold turkey doesn't work. A lot of people think that if you want to give up, sugar, you got to just wake up one day and say, that's it, I'm done, no more sugar.
Right.
But it doesn't work. It doesn't work from a psychological standpoint, because you're setting yourself up for failure, because there's so many products that have sugar in it. There's so many ways in which you can be, compelled to relapse, because it's being bombarded at us at all times with advertisements. You go into the office and it's somebody's birthday, and so there's a cake, and it's just really in our face a lot. So I advocate more of an approach where you try to reduce it and replace it with something healthier, and you do it little by little. And so I suggest that people start off with beverages. Take a look at what you drink every day. If you're drinking soda, if you're drinking juice, it's time to talk about how we can maybe replace that with something else that's going to be a little bit better for you and healthier and have more nutrition and allow you to get some of that sugar out of your diet, and then go from there. And it's not something that's going to happen overnight, but it is going to happen, and people will find that it gets easier as time goes on, and you have more control over what you put in your body.
I'm glad to hear you say that, because it sounds like I'm on the right track. Hi, my name is Millie. I'm a sugar addict, former sugar addict. No, I did really struggle with this. And it was one of those things that my brain almost didn't register that the meal was over until I had dessert. Like, I kept nibbling and grazing and eating, because my brain did not know that I was done until something sweet hit my palate. And I did just that. I started to the easiest thing is just to, like you said, stop drinking sodas and drink water. And so I did that. And then just transitioning more to watermelon, strawberries, and fruit sugars and things like that. So I really do appreciate you reaffirming that I'm on the right track.
Yeah, it sounds like you are. And it's funny, maybe you had this experience. I've had a lot of patients that I've worked with who were eating a lot of sugar, and then they cut it out and they're reducing it. And then they start to eat fruits like watermelons or, berries. And they're like, wow, they're so sweet and delicious. But they didn't really appreciate the taste of it before then, because their tongues and their palate and their brain was so programmed to want this really high dose of sugar that the low dose of sugar that you're getting from fruits just wasn't even detectable.
great. And I tell people you almost have to train your palate. You know what I mean? Like you go
Hmm.
back to those regular sugars. I used to be a big McDonald's iced tea drinker.
Hmm.
Don't judge me. But when I went back to that, I was like, oh my God, I could hardly take it because
It's
I
aversive.
trained
Yeah,
myself to deal more with the natural sugars. So
absolutely.
going to pregnancy now, when a woman says she's eating for two, and again, I have to admit, I've been pregnant several times. I've birthed 7 children.
Oh my goodness. Good for
Yes, yes,
you.
yes. And there have been times where I've gone to restaurants and I've ordered 2 full entrees. So when a person says they're eating for two, is that really true?
Well, you are eating for two in the sense that you're nourishing yourself and your baby. And if you're having multiples, maybe you're eating for three.
Right.
So you are eating for two, but you don't need to eat the amount that two people would eat. And so that's something to keep in mind. And
Right.
so when you think about it from the calorie standpoint, actually in the first trimester, you don't need any extra calories to sustain the baby. And even when we go beyond that, I mean, we're talking just a few hundred extra calories in the second and third, about what you'd get from eating maybe an apple and a couple tablespoons of peanut butter. So it's a small amount of extra calories that you actually need. And I think my advice when I talk about this is to focus not so much on how much you're eating, but what you're eating. And I talk about this a lot in my book, What to Eat When You're Pregnant. And then also in my new book that's coming out, What to Eat When You Want to Get Pregnant.
Gotcha.
It's really about the foods that you're putting in your body and the choices that you're making, and not counting calories or counting how much weight you're gaining, or, you know, whatever number you want to attach it to. I think it's the focus should be on, you know, wholesome foods, eating things that are going to be really nutrient dense. And you'll find that you'll be able to regulate how much you eat, and you'll eat the right amount because you're going to get all the nourishment that you need from the food that you're actually eating. A lot of times with like restaurant meals and, you know, processed foods, we tend to overeat them
Right.
because we get enough calories, but we're not getting all the nourishment that we need. We're not getting all the vitamins and nutrients that we actually need. So our bodies are still craving something, and it's actually just the nutrients. And so that's where we get into trouble sometimes, because people end up overeating, and it can lead to excess body weight. It can lead to cardiovascular issues. And when it comes to pregnancy, it can lead to us just having an uncomfortable pregnancy. I know I went through this twice only, but I remember being pregnant both times. And, you know, everybody carries their pregnancy differently, and what you eat can really have an impact on how you feel, especially during pregnancy.
Right. Right. So would you say that it's some, would you advise, I know you have the 2 books out. So there's a difference between what to eat when you're pregnant and what to eat when you're trying to get pregnant? Can you explain?
Well, great question. And so, What to Eat When You Want to Get Pregnant is the book that I have now that is really about understanding the food environment and how it can impact our fertility. And what we're learning is that there's so much that's happening in our world in terms of, you know, chemicals that get into the foods, different ingredients that are put into foods that can actually have a negative impact on our fertility. And this goes for women and also for men. And so what we're seeing now, another trend that's emerging, is that people are delaying having children. People are waiting until later in life. And so it's not uncommon for, you know, women in their late 30s, 40s to start their families then for various reasons. If it's a career that they started off with, or simply just that they want to wait. And so we know that the window of opportunity to have a baby gets narrower as we get older. And so what we're finding is that as a society, we have people who are trying to get pregnant when it's probably going to be maybe a little bit more difficult to get pregnant just due to their age. And so nutrition can have an impact, and it can really help. And I think that, you know, it goes for women and also for men. We're finding too from the research that what a man eats can have an impact on his fertility and sperm health. And that's also equally as important.
Absolutely. And I think that's great that we're including them. I think we need to include men in the fertility conversation a little bit more, but that's another topic
Absolutely.
for another day. So what advice would you give plant-based moms, you know, vegetarians, vegans, people who have an alternative diet? Some think that that might be dangerous for a baby. What is your advice?
No, I don't think it's necessarily dangerous. I think that if you're following a plant-based diet and following it well, you can do really good and have all the nutrients that you need. You do need to be mindful about certain nutrients that are tough to get from plants alone. So like B12, for example,
Right.
is something that perhaps maybe you need to take a supplement for, but that would be something you'd want to discuss with your doctor. What I don't recommend is that people decide to go plant-based when they find out they're pregnant, to have this radical shift in your diet when you are pregnant. I don't think that that's a good time to introduce a new style of eating where you're excluding certain categories of foods, because, you know, anyone who has followed a plant-based diet knows that there's a lot of learning that goes along with it to try to figure out how you're going to get enough protein, what are the sources of the different nutrients that you're going to get to allow yourself to, you know, have everything you need, where are you going to get your calcium from if you're not consuming dairy.
Yes.
And so these are questions that, unless you're a dietitian, aren't always like easy to figure out, but I do cover it a lot in my books. And so it's a good resource for people who are interested in learning the different sources of these different nutrients that we need for pregnancy, because it doesn't all have to come from animals. Many of the times you can get everything you need from plants.
Okay, can you quickly tell us how diet affects the actual baby? Like, how does what I eat affect my baby? I take in broccoli, and how does that translate to
Well,
what's going
it
on
affects your
inside?
baby in so many ways. And so from the fact that if you're eating broccoli, which would be a wonderful thing, your baby is actually going to have essences of that taste of broccoli that it's going to detect in the womb. And there's been studies that have been done that show that women who eat vegetables during pregnancy, or who are instructed to eat a certain amount of vegetables at different points in their pregnancy, are that given birth to babies who are more likely to be acceptable of eating those vegetables.
Mhm.
And it's because they have this memory of it from having it in utero, from having it in the womb. So it has an impact on your baby's health in terms of their appetite and their palate development, even when they're in the womb. But it also has an impact just on all the different things that are growing. I mean, your baby is developing for that 40 weeks of pregnancy, and different parts of the body are developing, different parts of the brain. We want to make sure we're getting enough healthy fats in our diet, because brain is essentially fat. We need fat for our brains to develop and to function properly. And especially for growing brains, they're really dependent on that. So getting omega-3 fatty acids, things like avocados, having, you know, fat that comes from fish like salmon, for example, is a good source, is really a good thing that you can do to ensure that your baby's getting all the nutrients that they need to grow healthy.
So you're giving your baby a head start by eating well yourself.
It absolutely.
Thank you so much for all the valuable information that you've shared with us today. Let us know where can someone find your books?
Yeah, so books are available wherever books are sold online. You can also go to my website, drnicoleavena.com, and you can follow me on social media at Dr. Nicole Avena. And I have lots of tips and information about healthy eating, kids, family stuff, and really just helping families and all of us have healthier lives and using food as a tool.
Sounds good. I am going to go follow you right now. Thank you so much for joining us. I appreciate you. I am MILLI Long with Power of the Patient Project.